when you open the door for somebody else.
Welcome in, everybody, to the vaccine conversation. It's good to be back.
What does that mean, welcome in?
Welcome in, because they're out, and then we start the show, and they're in. They're in the room with us.
They're in the vibe.
Yeah, they're in the room.
Okay, got it.
Right. How was your weekend, Melissa?
You know, when you're a mom, Dr. Bob, you don't have a weekend. A weekend is a continuation of a week, which is a continuation of another previous week and another week before that.
You told me that before, and I stand corrected. I'll stop asking.
Yeah, well, men don't quite understand.
No,
hey, am I right, ladies? No. Just
Okay, well, yeah. Well, my weekend that I had, because
you get to have one.
Yes, yeah. Actually, it was all work. I spoke at our local La Leche League conference. I gave this talk about vaccines for pregnant and postpartum women. And I know that's a topic you actually want to go over. So I do.
I hear about that all the time. I get lots of questions about that.
I'll turn that talk into a podcast episode, and we can talk all about that. But so actually, I didn't get a weekend either. So I know what it's like to be a mom.
Yes, you must know exactly what it's like. Oh.
Yeah, right. Well,
this is podcast number 9.
Yes, it is. Yeah, and today we're going to talk about. We're actually not sure what to title this yet, so we're gonna think about what to title it. But it's a podcast for new parents. I think we have a lot of different topics, and some of our topics are for activists or people, veterans to the vaccine conversation. But some of our podcasts have been for new parents, and so if you are a new parent, I think this is really targeted towards you. Just as our previous episode about the vaccine schedule, I think was kind of a good overview for new parents.
Or if you're a parent who's still expecting another child, because even if you're not a new parent, but you're having another one, and you're going to be having a new baby. So anyone with or a family member that's having a new baby, and you're kind of interested in some of this stuff to be able to relate information to them. Yeah.
Let's keep talking about what it might be about, and let's just not tell them. And they'll be like, what's it going to be about? So it's basically, we're going to go over each of the infant diseases that we vaccinate against, so that you understand as a new parent, what is this disease risk? You know, what is the big deal with these diseases? What could babies die of in the first year of life? What diseases pose the most risk? What diseases actually don't pose much risk? And basically, I think, kind of to get in the mindset of a new parent, I think parents who are thinking of not vaccinating, or some parents who are thinking of putting off the vaccines or delaying the vaccines.
Or deciding which ones to get.
Right. Yeah. Which ones to get. They need to know the risks of the diseases. And so they know what risks they're taking by not vaccinating, because that's very important to know the risks on both sides of this. And so that's kind of what we're going to go in today. And I wanted to touch real quick, though, as I was listening back to our first podcast and kind of evaluating, how we sounded, how things were going. I came to realize that a lot of times we kind of focus on some of the negative aspects of vaccinations, or we often will talk about vaccine side effects and the media. We totally, talk a lot about how the media spins vaccine information towards an agenda. We tend to talk kind of down on pharma some, and how pharma sometimes might not be giving us all information. And I kind of wanted to point out that we're definitely not trying to make this be an anti-vaccine podcast or a pro-vaccine podcast. It's basically a vaccine podcast where we're just talking about these things. But it hit me that, and you and I talked about this when we were presenting or preparing all our talks and our lectures we give. Everyone already gets the other side presented to them. Mm-hmm. Everyone already gets the pro-vaccine side in the media and from their doctor. And so I feel like a lot of parents are automatically already getting that information. You and I don't always take the time to present that information because we only have so much time, right? Of course. And I guess if we gave every single, aspect of both sides, we would, be here a very long time. So I think there's kind of an assumption that you are getting the mainstream medical opinions already told to you as a parent. And so I think we're focusing on the aspects that are kind of more neutral, or might be a little bit more on the anti side, and that we're trying to get you to think about things you might not have been told.
Well, and to clarify, that's anti-mandate, which is one thing that we say. And this is not about being anti-vaccine. I mean, a lot of people who are not vaccinating now were previously vaccinating, and there's so many different categories of people who are pro-informed consent, and they are against mandates, and that's really where we stand. I personally don't feel the need to apologize for only presenting this one side of the information, because you're right. It's literally all you hear. Everything on the other side, the pro-mandate side, everything, you'll find that everywhere. That's the only narrative that anybody is hearing. And that's why I think it's so important that the other side of this is even brought to the table.
Right.
I mean, that's what we're doing. Like, it seems weird to have to say, oh, and we need to also include that so we show we're fair and balanced. I mean, unfortunately, as we'll do later on, the second you question anything, the second you question vaccine safety, the second you wonder if maybe they're getting too many, if maybe there are some conflicts of interest, if maybe there are some spinning stories in the media, the second you mention that, or you're questioning anything, you're instantly labeled, like what you're saying, to where you feel the need to say, oh, this is not anti-vaccine, just so you know. And I see that all the time. I mean, there is our side of things is not being told. That's the truth. Right. And that's why this vaccine conversation, as much as I mean, we are being impartial as far as all of the data, all of the information is 100% sourced and accurate information. Nothing is, we're not spinning anything in any different way. This is
or if we have an opinion we're sharing, well, we'd be upfront with that about an opinion.
Yeah, I mean, this is just straight information, but this is also information people aren't getting.
Right. And I think just for anyone listening, if you're new to us, and I almost feel like I want to go put this back in the edit this into the first episode or something, just as a disclaimer. We just kind of want you to know where we're coming from. So if you are a parent who is, maybe you're very, very comfortable with complete vaccination, you're very pro-vaccine, and you're kind of listening to this, I sort of want you to know why we are having the discussions we are, and we're not necessarily telling the complete side of that story, because just for the reasons you're saying. So again, I just wanted to put that out there, that so that you understand where we're coming from and why we're doing this.
The added bonus of what we're doing is we're not telling anybody what to do.
Right.
So like that parent,
unless there is something obvious that they should do, we'll tell them, and that's
research some information, which is
get informed consent. And you also said it. We're anti-mandate, and we are. I'm very much kind of against the idea of anybody doing any sort of medical treatment without getting full informed consent. So we're pro-informed consent, we're anti-mandate, and everything else I'd say we're basically neutral. We're just here to present.
Well, and somebody who is super pro-mandate, pro-vaccine, whatever, their life experience has led them to that place. There's still information that they could get from this, because this really does kind of cover for all people. It's just straight up information. But we're giving to the other side some time that they don't usually get. So I think there's absolute value to that. Okay. And that's for new parents and for parents that are already.
Yeah, so I felt like that was important because that occurred to me as I was kind of listening back. So anyway, on to today's topic. So I guess I'm basically going to talk about hepatitis B disease, diphtheria, tetanus, pertussis, which is whooping cough, HIB, HIB, pneumococcal disease, polio, rotavirus, and the flu. Those are kind of all the infant diseases we vaccinate in the first 9 months of life. We vaccinate against it in the first 9 months of life. I'm just going to go through each of those, and some I'll spend more time because it's more of a big deal, and some I'll spend less time.
And we will be having full episodes for each one in the future. Right. We're going to be targeting just one specific, an entire podcast that would be a specific infectious disease, talk all about the history of the disease. Yeah, like
we might even be doing just whooping cough next.
That might just be happening.
If I can keep Melissa awake.
Hint, that is going to be happening.
So anyway, let's just go over. So basically, hepatitis B is a virus that you catch through blood exposure. So it's basically a sexually transmitted infection, or you can very, very rarely get it through a blood transfusion. And we vaccinate, it's on the schedule for all babies. Originally designed because if a mom has hepatitis B, she can pass it to the newborn baby during the birth process through all the blood exposure. And so But of course, moms are tested for hepatitis B, so we know who has it and who doesn't.
Right, ahead of time. Mm-hmm.
And less than 1% of American moms have hepatitis B. So for the most part, most babies are not going to catch hepatitis B while they're babies or while they're young children. If you just want to kind of understand the actual data, every year in our country, they've had about 350 or 360 babies coming down with hepatitis B every year from unknown exposures at birth, like they didn't know mom had Hep B at birth, or the very rare blood transfusions. About 360 babies every year, babies or children. Other than that, there really is little to no risk until babies are older, until they become teenagers. And I think a lot of parents ask me, well, what if someone bleeds on them at school? Or what if, there's actually one case report, only one case I've ever heard of hepatitis B being transmitted non-sexually or without sharing IV drug needles. And it was where a child who has hepatitis B, like they caught it at birth and they're chronically infected, the child sneezed onto the teacher's hand into her cut on her hand, and the teacher became infected with hepatitis B. They don't know for sure it came that way, but that event occurred. The teacher was freaked out.
She was also a drug user, but that was
right. But so I mean, the chance that you're going to catch hepatitis B in that really obscure way is virtually non-existent. In fact, the CDC specifies on their website all the ways hepatitis B cannot be transmitted. Lists all these just casual contacts, sharing food, sharing utensils, sharing saliva, kissing, just day-to-day casual contact. You do not transmit hepatitis B that way. But
yet this is the first one that all babies are getting.
Right. So it's on the schedule first. It's on the schedule at birth, 1 and 6 months.
And it's being added to some of those school requirements too in some states, right?
If you don't get it as a baby, they do require it in schools if you live in a mandatory vaccine state. But I would say as I go through each of these diseases, I just want to give a little summary whether or not that's a risky disease. And I think you can. You
want to put on a scale of 1 to 10?
It's safe to say, Would
you say where's the riskometer?
Yeah, the risk is 0, 0.1. I think any doctor would tell you, for the most part, that hepatitis B is not a disease that infants are at risk of.
Our previous pediatrician, even in the hospital when I had delivered my first, said, "Oh, do you want to give this vaccine?" And I said, "Is it necessary?" I mean, my biggest concern was, what is the minimum I should really do to protect this baby? And even he said, if you're not, his exact words were, if you and your husband are not IV drug users, then it's not necessary. It's probably not necessary. So even somebody who ended up ultimately kicking us out of the practice for not continuing to be up to date, with a full schedule, still was the one saying, you don't really need this one. And
which is surprising because almost most medical professionals get mad at you for not vaccinating. Not so much because of the disease, but just because you're questioning the man, you're questioning, or the woman, you're questioning the protocol. And it sounds like your doctor was more upfront with you.
Well, this was almost 6 years ago, too. So it probably would be a little different now because of the climate. The climate has become so hostile that, I don't think they would necessarily be honest about what you just said with the fact that most doctors would say there isn't much of a risk.
And I think the main risk with looking at the hepatitis B vaccine, again, if you're a new parent sitting there listening to this, you're trying to decide, should I get the Hep B vaccine or should I not? And again, we're not telling you what to do, but the main risk of the vaccine is that it raises the chance that your newborn is going to have a fever, poor feeding, get lethargic, and have to go to the intensive care unit to care for that medical emergency. And if you look at the actual research, there is a study that was published after we started giving the Hep B vaccine to everybody that shows the risk of catching a fever as a newborn doubles if you get the Hep B vaccine. In other words, most newborns don't get fevers, but if you do get a Hep B vaccine, you do have about twice the risk of now suffering a fever. You can't eat. You're very severely lethargic or extremely irritable.
Or dehydrated.
You go off to the NICU for intensive care to figure out, do you have an infection or is it just a Hep B vaccine reaction? So that's kind of one of the main drawbacks for babies.
And of course, there are other side effects.
Yeah, there's so many side effects. So again, I think you said we're going to give an entire episode on each one of these.
Yeah, I just want to confirm so people don't think because that sounds a lot like what you might be told in your pediatrician's office.
Right. The only thing that
it might double your fever, and so hopefully not.
Well, the reason that's significant is it's for a newborn.
Yeah.
If a newborn gets a fever, that's a medical emergency. If a 1-year-old gets a fever, that's okay. Anyway, but you're right. We'll touch on this on the hepatitis B episode. Okay, so then the other disease your baby might catch is whooping cough, pertussis. We don't give that vaccine until 2 months, 4 months, and 6 months, because the vaccine doesn't work very well if you give it to a baby when they're too young. So babies are left vulnerable to whooping cough. What's the deal with whooping cough? Basically, we have tens of thousands of cases in our country every year, if not sometimes even as many as 100,000 cases of whooping cough. It's a terrible disease for newborns. We have between 5 and 15 babies die of whooping cough in our country every year, between 5 and 15. So let's just say average of 10 whooping cough cases where babies die every year. Some data show that if a newborn catches whooping cough, the fatality rate for that newborn is actually as high as about 1 in 200. Like if you have 200 newborns who catch whooping cough, one of them might die. So you have to emphasize it is a pretty bad disease for a newborn to catch. Fortunately, most newborns don't catch it. For the most part, it's usually kids who are older and in school where whooping cough goes around.
But the fatality rates are usually all with...
Right. No one dies of whooping cough if you're over 3 or 4 months of age. It's pretty much all those, average of 10 fatalities, they're all newborn babies 3 months or younger. So if you get whooping cough, it's a pretty bad cough. Baby might have to be hospitalized, might need some IV fluids, might need oxygen. It's treatable with antibiotics. So if you catch it early... Because
pertussis is a bacterial infection.
Right. If you catch it early and get on antibiotics... it can make a big difference. If you don't catch it early and your baby has a really bad cough for a week or two, and then you realize it's whooping cough kind of too late, antibiotics won't help. Naturopaths would recommend a very high dose vitamin C protocol for whooping cough, which might reduce the severity of the cough.
And what about breastfeeding for these young infants?
Breastfeeding helps protect you, I think, against almost all diseases, but it's certainly not perfect protection. And some diseases are milder if you're breastfeeding. Like we know some of these other diseases we'll talk about. Oh, there's my cell phone. Matt, you're texting me. Oh, no, Hayden's texting us. Okay, never mind. Let me put on cell phone.
So silent. Unprofessional.
I had it on silent. I don't know what happened. Where were we? I don't know.
You said breastfeeding.
Breastfeeding. But honestly, even a breastfed baby who catches whooping cough can be seriously ill. And but I think a lot of parents need to realize the time frame in which whooping cough is dangerous is relatively short. It's the first 2 to 3 months of life. And so if your child is not in early daycare, or you don't have 5 other kids running around the house, especially new babies, the first baby in a family, the risk of catching pertussis is relatively low. It's not zero, but it's pretty low. So anyway, and then I guess I should also add, we are now vaccinating pregnant women against pertussis so that their babies are going to be born with some antibodies in their system to help reduce the risk of pertussis.
And this is in theory, right?
In theory, right. Yeah. They have one study so far that shows if a pregnant mom gets a whooping cough vaccine, it lowers the risk of her newborn developing pertussis in the first couple of months of life. It lowers that risk by about half. It's not a very good study yet. It's preliminary, so we don't know for sure, but we know it might help. But if it does help, so far we only know it helps by about 50%. So anyway, whooping cough is a bad disease. There's no doubt, but I think once you're no longer a newborn, it's not serious. It's just a routine disease. But I hear so many parents come in and tell me, oh my gosh, I heard whooping cough is deadly. Does my 5-year-old need this vaccine now? And I have to then explain all this.
Well, also, whooping cough is very contagious.
Very contagious.
And it's contagious in vaccinated populations, too, which is important. Right. And we'll get into that. We've talked about asymptomatic carriers before. Right. It's important that people understand that because this is a risky disease, you think, okay, I'm going to get my child vaccinated. the vaccinated child can also spread this to other people and be exposed to by other vaccinated children. So that's the downside, is as much as this is a risky disease, getting the vaccine is not foolproof in protecting, unfortunately, because there are so many asymptomatic carriers with this particular disease. And I'm sure we'll get into that a lot. But, again, for the new parent who's just checking out this episode, keep listening for the other aspects of it too, because in the end, this really does come down to a cost-benefit analysis for your family about what is more risky for you.
Yeah.
And you're trying to find out what makes the most sense. Yeah, you're saying the vaccine may protect in this little bit, perhaps up to half. Let's say if you're pregnant and you're having this vaccine during that crucial time, it may and it may not. And then there are also side effects. And you just come back to what makes the most sense. How likely am I to catch this?
Right.
How risky is it if I do catch this? What can I do to maybe keep that from happening?
Right. And I like looking at numbers because, for example, we have 4 million babies born in our country every year, and about 10 of them will die of whooping cough. So that's about 1 in 400,000 babies will die of whooping cough. It's very tragic for those 10 babies. When you think of 1 in 400,000, that's not necessarily the raging epidemic that I think those in the media or those in the pro-mandate medical world might try to stir up the fear of pertussis, saying your baby is going to die if you don't do this vaccine while you're pregnant, and your baby is going to die if you don't do this vaccine on time at 2 months. The chance of that happening, you have to realize, is 1 in 400,000, which isn't zero, but it's
much smaller.
It's not high.
I agree. I mean, considering that California had a very large outbreak in 2014, I remember when SB 277 was coming around, a lot of what legislators knew and why they were supporting the mandate was, I heard some children died in this big outbreak, and whooping cough is fatal and it's very dangerous. And it was the same thing. They didn't actually know the numbers to know how rare it is for that to happen, and how specific the niches of those who are susceptible to dying from pertussis. But that was absolutely the driving force. One of the major driving forces, even before the measles outbreak, was the pertussis outbreak in California, where there were 9,000 cases, 9,500 cases.
Yeah. And again, so I guess let me touch real quick on tetanus and diphtheria. The reason I'm touching on those with whooping cough is it's all in the same vaccine.
But wait, can you first mention about the vaccine itself when it comes to pertussis?
Well, no, I thought I'd throw in tetanus and diphtheria first and then talk about it as a vaccine as a whole, because it's all kind of grouped together. But tetanus is in that vaccine as well. And every year in our country, we have about one baby or toddler, one young child who develops tetanus in our country from a real serious wound. About one child. We have about 5 teenagers who develop tetanus in our country every year, and we have maybe about 20 or 30 adults who develop tetanus. Tetanus, you know what tetanus is. It's a paralyzing disease. You sort of become temporarily paralyzed because of the germs breeding in your wound and secreting a toxin that paralyzes you. So American babies don't get tetanus. I mean, bottom line, there's about 1 case a year, but in all reality, American babies and young children do not catch tetanus. And so it's basically a vaccine that's kind of automatically in there because they mix it with the whooping cough vaccine. But it's honestly a vaccine that doesn't need to be there for American babies, but it's kind of there by default.
And so that people know, whenever somebody says you need to get a tetanus shot, it's never just a tetanus shot.
Right.
Because tetanus, it's only either tetanus and diphtheria, or it's tetanus, diphtheria, and pertussis. It's never solo. Like, that's not something you can just get a tetanus shot anymore.
Right.
It's going to be some type of combined vaccine.
Right. And so then the other disease in there, diphtheria, tetanus, diphtheria, pertussis vaccine. Diphtheria is a terrible disease, and we've eliminated it from the United States. It's like a coughing respiratory disease. It infects your airway, and you can't breathe very well. It used to kill a lot of people a couple generations ago when we had diphtheria.
So if people were saying it was in part or because of the vaccine, is that pretty accurate that it has been eliminated here?
No, this is actually an example of a disease that was not eliminated because of the vaccine, because the diphtheria vaccine doesn't stop you from getting infected. Just like the whooping cough vaccine can't eliminate the disease because it doesn't stop you from getting infected. Diphtheria vaccine does not stop you from catching the germ and becoming sick with it. It just neutralizes the germ toxin so the toxin doesn't swell up your airway. And so it's just going to make you not feel as sick. But the reason we got rid of diphtheria is because it's a bacteria, so it's treatable with antibiotics and antitoxins. It goes around in poor communities or impoverished children who are malnourished. So once we got on top of a lot of those problems and improved our standards of living, that disease went by the wayside. So essentially, diphtheria and tetanus are diseases, and we've eliminated diphtheria from the United States. Some years there's one case that shows up somewhere obscurely. Some years we have 0 cases. So we've eliminated diphtheria. We don't have tetanus in American children. So when you're making the decision to get a DTP vaccine, you're not making the decision based on those 2 diseases for babies. You're making it based on the whooping cough.
So why do you think they don't offer the pertussis vaccine?
Oh, they should.
Solo.
They should. And I think I suspect they're looking at it because they're trying to figure out if we could make a whooping cough only vaccine, would that be better for pregnant women? Instead of giving them the vaccines they don't need, just give them a whooping cough vaccine and could we get one for babies? That would be great because you're right. It's very targeted towards a vaccine, towards a disease that is, we really do need
instead of 2 entire components that you wouldn't need at that time. And because of the pertussis, the vaccine, DTaP or Tdap, and if you're over 12, doesn't have the same level of efficacy that a lot of vaccines does. It tends to have a poor efficacy rate and waning immunity, which we'll talk about later. It doesn't last that long, 2 to 3 years around on average, which means you would constantly be needing booster shots to be able to keep that pertussis component strong enough to keep you from, again, experiencing the symptoms, but not necessarily keep you from spreading that to other people. But I always find that odd when they don't offer. So most people are concerned with measles and whooping cough, I'd say. Like if people had to come down to it, those are the 2 people would be most concerned with. And neither of those are offered in single vaccines, which seems so odd to me because those are the most in demand, especially considering outbreaks or things like that. I mean, those are the 2 things pushing all of the legislation across the nation, pertussis and measles. And you cannot get a vaccine, a solitary vaccine for either of those 2. I find that to be so weird.
Right, and what frustrates me is they actually make the pertussis vaccine separately at the start of the process. They actually do make it separately. It exists separately.
Well, and they used to sell measles by itself.
Measles by itself, yeah. But then at the end of the vaccine, at the end of the manufacturing process for DTP vaccine, they mix the DT together, and then they take the pertussis, and they all mix it together in the final step.
I've always been curious about that. What do you think the point is of having a combined?
It started back when we needed all 3 vaccines. And they just made
originally
them
when it was DTP.
Right. We needed all 3 vaccines, and so they put them together. And then,
but now that we don't, do we need diphtheria really at all, considering it's not in there, and yet it comes 4 times, 5 times in early childhood?
Yeah. So diphtheria, tetanus, pertussis. And again, consider what we talked about pertussis when you're looking at disease risk. Now, looking at vaccine risk with this vaccine, the main risk is the main serious side effect is encephalitis, which is a swelling and inflammation of the brain. It's on the CDC vaccine information statement, encephalitis. It occurs in about 1 in 1,000 babies. Seizures from this vaccine occurs in about 1 in 14,000 babies, or it might be more frequent than that, but at least the number they're admitting is 1 in 14,000. Those risks, 1 in 14,000 of a seizure or 1 in 1,000 of encephalitis, both of those risks are higher than the disease fatality risk of 1 in 400,000. And that doesn't mean you shouldn't get the vaccine. It just means you need to understand there's disease risk and there's vaccine risk, and you need to make the decision.
Yeah, and also, like you're mentioning about seizures, what's listed there, encephalitis, what's listed there, and we've talked about this before, the big problem is that when people do have those things, they're often not going to be associated with the vaccine. So, they're not going to be admitted that they're associated with the vaccine. Logic will tell you that these numbers are higher, much higher, because when you typically have a seizure, even if it's within 7 days of a vaccine, you're going to go somewhere where they're going to tell you it's not related. And I'm sure it's not getting documented or reported as such, because that's just not what they believe to be true. So when you say 1 in 1,000, I feel like it's much higher than that. And seizures, I've heard so many cases of people having seizures after DTaP vaccine. I feel like because even our doctor said, this is normal, whatever, I'm positive it wasn't documented. And so that means the numbers that we're getting access to are not even accurate, which is unfortunate because that really also weighs into your risk-benefit analysis. You want to have numbers that make sense, and the numbers really are a little bit one-sided when it comes to this, I've found.
Yeah. And we can only go with the data that we have, I guess, as doctors like to say. Sorry. Yeah, there was an eye roll there, you guys. You guys just didn't get to see it because this is
Maybe they can hear it. Let me do it again. I'm going to do it really hard. Okay, ready?
Okay, all right. Okay, so the next disease, again, we're focusing on disease risk for new babies and parents. HIB, H-I-B, is a Haemophilus.
B as in boy.
Yeah, B as in boy. Haemophilus influenza type B is what that means. It's a bacteria that causes meningitis. It's very serious if you get it. What is for HIB? Something like maybe 10 or 20% of babies who catch HIB will die from it, who catch HIB meningitis will die.
You said 10 to 20% of those who catch it.
Right. Now, but the good news is we only have about 5 cases of HIB in our country every year. 5 to maybe sometimes 10 cases.
Does that mean 10 to 20% of those would be fatal?
Right, yeah. So out of the 5 to 10 babies who catch HIB disease in our country every year, about 10 to 20% of those are fatal. So again, we might have one baby who dies of HIB in our country from this bacterial cause of meningitis. So you can't argue that meningitis is not a serious disease. It is always a serious disease, no matter what, no matter who catches it. And I guess we're very fortunate. And, we used to have thousands of cases of HIB in our country every year. Back before we had this vaccine, we had many thousands of cases of HIB.
Is that another one that you feel has been adjusted and changed through the course of time as we've all gotten healthier as a society kind of thing?
Well, I would say with the HIB vaccine, that is an example of a vaccine, honestly, that probably has reduced this disease. Because it wasn't so long ago where we had those thousands of cases every year. That we're talking the 80s. In the 80s, we had many thousands of cases, maybe 10, some people even estimate 20,000 cases of HIB every year in the 80s.
And 10 to 20% of those were fatal?
Yeah, it's terrible. It's terrible. And I think so people who grew up in that generation were very scared of HIB. So that's probably an example of a vaccine success, I will say. Some might argue against that, but I think the majority of people would agree with me that it's a vaccine success. So I guess as new parents, you have to decide, do you get a HIB vaccine at 2, 4, and 6 months as it is on the schedule? To avoid an extremely rare, almost eliminated disease. And is that something that needs those 3 doses to acquire a sufficient immunity? Yeah, to get a good level of immunity, you need all 3 doses. We talked about the risk of DTP vaccine, how there's very significant risks of reactions with DTP vaccine. We don't have similar high degree of severe reactions with HIB vaccine. It's not known to cause seizures or encephalitis. And if it does, it'd be a lot less frequent than the DTP vaccine. I think the main thing that stands out with HIB vaccine in the research, and if you Google search HIB vaccine reactions or side effects, you'll see some medical research looking at very rare cases of type 1 diabetes. Starting right in direct timing with getting HIB vaccine. I met one of those babies in my office who saw me after the fact. Of course, almost everyone who gets a HIB vaccine is not going to catch diabetes. It's a very rare reaction, but it is known. They've seen it happen. So again, I think this is all just about information. Parents need to, understand the risks. Well, and I know we'll probably cover this at some point, but do you think, some of these side effects that happen with certain people, like let's say this particular child, something genetic that basically is laying dormant until an environmental trigger sort of turns it on. And in that particular child's case, it was a diabetes was a genetic condition that basically was laying dormant
Do you think there's a chance that's pretty much how it works? Like the vaccine goes into the system, and whatever component of that has this really odd, like it turns on a switch basically
it's an autoimmune reaction, because that's what diabetes is. Your immune system attacks your pancreas, so you don't make insulin. Something about the Hib vaccine in very, very rare kids will turn on that autoimmune reaction, and it destroys your pancreas. Very rare.
I definitely want to. I want to go into more. I find that so interesting. The idea, epigenetics. The idea of on another episode. Well, I mean, just so that people understand when you're thinking of side effects, like one in X number of kids can get diabetes from the Hib vaccine. That these are all things that are essentially latent in an individual, in all of us. We all have things that are latent, that are genetically there.
Some of us more than others, probably.
But then those things get turned on by different environmental factors. I truly believe that, and I believe that for some people that could be heavy metals, or light metals, or live viruses, or different things that all basically turn things on. And that's why it varies so much from child to child. And that's why some kids are more susceptible, and there's really no way to sort of check that ahead of time. And that's why personally I'm so against mandates, is because you never really know. I mean, I've never even heard of diabetes being something that could be triggered on by the Hib vaccine, but it exists. And these are the kind of things that you're seeing come up with people. It's not because the vaccine's causing, like as a side effect, it's somehow creating diabetes from the vaccine. It's the components of the vaccine going into the body, something being triggered and turned on for whatever genetic predisposition that particular individual had. And that's why we are concerned, because the same thing happens for adults. That's why somebody can get the flu shot and be fine, and somebody gets the flu shot and it triggers some kind of terrible reaction. Right. I'm so interested in how that works with our body, and this is a perfect example of that.
Right. Well, if you are interested, we're going to have to bring in a genetic specialist, because I don't know.
No, we should.
I don't know a lot about the epigenetics and the metabolic changes that go along, and as you're talking about. But it is a very fascinating area. To figure out who we can bring in here. But just to finish on Hib, it is bacterial, so it is a treatable infection. You can get antibiotics. If you catch a Hib infection,
is that why 80 to 90% then are not dying from it? Because
you get admitted to the hospital, you get IV fluids, and most kids that will then survive. Moving on, the next disease. How are we doing? Okay. The next disease is pneumococcal disease. That is a bacteria. And the whole discussion is pretty much analogous to Hib, in that it can cause meningitis, it can cause pneumonia. It is more common than Hib, but we don't know how common, because it's not a reportable disease. We don't have good data on pneumococcal disease, because most cases don't get reported to a central database. There are, I've looked at all the data we do have. I kind of would estimate we maybe have about 300 cases of pneumococcal meningitis every year in children in the U.S. We might have several thousand cases of pneumococcal pneumonia or pneumococcal bloodstream infections in our country every year. This is a bacteria that will invade into your body and cause these serious infections. It's also a bacteria that will cause a very mild infection, like a little cold or a little stuffy nose or mild cough. Pneumococcal bacteria, for most of us, our immune system fights it off and we don't even get sick from it. But very rarely it causes the meningitis and the pneumonia and the bloodstream infection.
And the vaccine has several strains, right? Isn't that
right? The vaccine has 13 strains in it. There are, I don't know how many strains of pneumococcal disease.
Right?
Yeah, it's called Prevnar is the brand name. There are many, many dozens, if not maybe over 100 strains of pneumococcal disease.
The handful of ones that they've seen.
They tried to find the 13 most common strains of pneumococcal disease and put it in the vaccine so that it lowers the risk. But
it used to be
it was Prevnar 7.
Yeah, that's what
they had 7 strains,
right? And
then they came out with 13 strains. I'm sure they're, in one country they have, I think, a pneumococcal 20. I might not be remembering that correctly. I don't know. I think it might be in Canada, but anyway, so they are going to try to expand the pneumococcal vaccine to incorporate more strains. But you can still catch pneumococcal disease even if you're vaccinated, because there are a lot of strains out there that we don't have a vaccine for.
Yeah.
In fact, I'd say maybe the one drawback of pneumococcal disease that they found is when they gave pneumococcal 7 vaccine to all of the kids in our country, it eliminated those 7 strains. It took them from being highly prevalent to being barely prevalent. Other strains increased, we actually didn't see any overall decrease in pneumococcal disease. We just saw the strains shift.
Yeah.
And one of the strains that increased dramatically was strain 19A, and it's resistant to almost all antibiotics. So we actually, by using pneumococcal 7, we created the resurgence of resistant strain. Lots of people were now getting sick from pneumococcal strain 19A, and antibiotics weren't working. So the new version of pneumococcal 13 has strain 19A in it. So we're now
another strain.
Right. We're now bringing down 19A and the other strains, but other strains are going to come up. So I like to say we basically picked a battle with a very diverse bacteria that can change and has so many strains we don't know what to do with. That I'm not sure if. I don't think people really thought out, is it a good idea to start attacking something that can change and can still, expand even though you're fighting some of it? Or is it better to kind of just let it exist in our population on generally low levels and leave it alone? I don't know. That's a question for the immunologist.
And treat with antibiotics if people had it or something.
Right. So, but pneumococcal disease is bad. I mean, I guess I did want to touch on this. I know we're kind of going a little bit long, but if you're a new parent, you're probably riveted and fascinated by all this. But I mean, in my 20 years of pediatrics, I've never seen a case of hepatitis B. I've never seen a case of diphtheria. I've never seen a case of Pertussis. I've seen hundreds of cases of whooping cough. I've never seen a baby die of whooping cough. Thank God. I might have hospitalized one kid with whooping cough, but if so, it was only one. I've seen several newborns with whooping cough, and they all did okay. I've never seen a case of Hib meningitis. I've seen 2 or 3 cases of pneumococcal disease, never meningitis, but I've seen either pneumonia or a bloodstream infection or a bone infection from pneumococcal disease. So I've had to hospitalize a few of pneumococcal. So when you're looking at is this a risky disease, I think pneumococcal is less common than it's probably about just as common as whooping cough.
Oh, really? Well, that's pretty
probably
common.
Is. Yeah, it's probably just as common as whooping cough.
But you're saying that for most people, they don't even
know it, right? Because it's mild and it's treatable with antibiotics. About 20% of pneumococcal cases of actual meningitis, I think, are fatal. So if you get the actual full-blown meningitis from pneumococcal, it's terrible. It's very serious. But again, I guess I've seen no children permanently harmed by pneumococcal disease.
Did you say what percentage of pneumococcal cases are pneumococcal meningitis?
We don't know. There'd be no data on that. I mean, I think we may have have about 300 cases each year total of pneumococcal meningitis in children.
And you're saying in thousands?
Tens of thousands or more, or even hundreds of thousands if you include all the mild cases.
Yeah.
So I think the main drawback of pneumococcal vaccination, other than the strains developing we talked about, is it makes babies incredibly irritable. The rate of irritability is extremely high. We don't see, I think, the extreme encephalitis like we see with DTP vaccine as often with pneumococcal vaccine, but we see a lot of incredible irritability.
What is that? So I think most people would be like, oh, irritability.
Yeah,
that's
okay.
just
it just means that the brain is being incredibly irritated by the vaccine. The immune system revs up and causes a lot of inflammation, and the brain gets irritated, and so you're really irritable from it. And
is there a different strength of the vaccine that infants are having when they have their first? It's the same as what?
Same. Yeah. Okay, so in interest of time, we have 3 more diseases. One of them we don't even really have to talk about. It's polio, because it's been eliminated from our country. We haven't had a case of polio in our country for 35 years. But you've heard about the polio outbreak that the media are talking about, right? They say there's this polio outbreak.
Illness.
Yeah, they call it polio-like. That has nothing to do with polio. It's a completely unrelated disease.
And we're definitely going to do an entire podcast on that, because I find that to be really interesting.
Right.
I want to go into more depth on that.
Yeah, so I feel like there's not much to say about polio. Your baby has, as close to 0 chance of catching polio as you can get in our country.
Even our the pro-mandate pediatrician that we had also had not given it to his own child at 5 years old until they were about to leave the country was the first time he said that he would think of it. And so even that was the other one that he kind of was like, I don't know if you really...
Yeah, so it's really little to no risk as an American. And that's also a vaccine that doesn't prevent the spread of the disease.
So when people say the reason that there are no more cases of polio, is it because of the vaccine?
Well, it's in part because of the old vaccine we used, the oral vaccine that we used to use. That actually did provide some immunity and reduce the cases. There are a lot of other reasons why we don't have polio: better health care, better cleanliness, better living conditions. So polio has diminished partly from the old vaccine, partly from just our society and as a whole.
But the oral polio vaccine was also really risky.
It caused
right?
polio. Yeah, we eliminated polio from our country in the 80s, but we still kept using the vaccine, and the vaccine was paralyzing about 8 children in our country every year. So it was causing more harm than the disease was because we didn't have the disease anymore. So they stopped using oral polio vaccine. Now we use injected polio vaccine. It doesn't give you immunity, and so it's not going to prevent like outbreaks from spreading. It's just going to make you not feel sick if you're exposed to the live germs somewhere. So
is that another one you think should not be one of the the automatic ones on the schedule?
Well, we're not. I think you and I are probably not going to say, I think, what we think should or shouldn't be on the schedule. I would say it's definitely one of the very low-risk diseases.
Because that's another big one that you hear about all the time.
Yeah.
Like in this debate, I often hear people say, remember iron lungs? Like, no, of course you don't because of the vaccine. And therefore, if you're somebody who's questioning vaccine safety, then somehow you're saying that that hasn't helped all those people and all the people that suffered as a result of catching polio and what it did to their bodies and things. That's definitely a debate that you hear frequently.
But you make a good point as far as automatic vaccines. It's interesting, once something is on our schedule.
Well, yeah, that's what I mean.
And maybe it was on there for good reasons, decades ago, it stays automatically on the schedule even after the fact.
Yeah.
After the fact
that's what I wonder. That's what I wonder that too.
So one of the last diseases is rotavirus. That's a vomiting, diarrhea, dehydration disease. It's an oral vaccine, so you swallow it. There are many strains of rotavirus, so you can still catch rotavirus even if you have the vaccine because it only covers a very small minority of the strains. But it's designed so that you basically, your baby won't get that vomiting, diarrhea disease and end up in the ER needing IV fluids. In our country, we have about 5 babies every year that die of rotavirus dehydration.
But and you're saying rotavirus, it could be of several strains, one that was not even covered in the vaccine?
Right. Yeah. Out of all the strains, about 5 babies will die. And they're not dying of the infection like you might die of other infections.
You're saying it makes them dehydrated.
Right. You're dying of the dehydration because you didn't go to the ER in time. You didn't see a doctor quick enough. And then they couldn't, resuscitate you and hydrate you. So, I mean, I think in our modern day and age of good access to emergency rooms, rotavirus should be something that babies don't die of. I think this vaccine would probably lower your risk of catching rotavirus and make it less likely that you need to end up in the ER. Rotavirus is unique, and it's not will you catch it. It's more when you will catch it. When will you catch it? Because it's a disease almost everyone catches. It's so prevalent. It's so common in child cares, in church nurseries, and health club nurseries, in preschools. Basically, you're almost guaranteed to catch this vomiting and diarrhea disease as soon as you've entered one of those worlds. And so, again, every child is going to probably catch it at least once. And again, if you're breastfeeding, this is one disease that is dramatically less serious if you're breastfeeding.
And the vaccine itself, I know, can cause like a lot of digestive distress.
Exactly. Because you're swallowing it can cause a lot of really strange intestinal symptoms.
I know we experienced that in our family.
Okay.
So after rotavirus vaccine.
Right. Yeah. I know. You told me. In fact, the rotavirus prescribing information says if your child already has a serious intestinal condition, don't get this vaccine.
Yeah.
Because we don't want to make that condition worse. And so, your baby's going to catch rotavirus. Those 5 babies that die, let's say it's 4 babies, just so I can do the math easily. 4 out of 4 million babies being born every year. That's 1 in a million, approximately 1 in a million.
That's actually
babies.
1 in a million.
Yeah.
That's a real 1 in a million statistic.
So it's tragic and terrible when it happens, but it almost never happens.
And it's early, like the first dose, they say not past 14 weeks. So
so 2 months.
The series,
2 months, 4 months,
It's
6
not
months.
like something that you're giving to your child as they're in toddler years or after that point. This is only recommended in infancy.
Right. This is the only vaccine you can only get in infancy. Yeah. Everything else you can get later. So rotavirus, and I think the main drawback of the vaccine itself, as far as data goes, is there's a 1 in 20,000 chance of suffering a very severe life-threatening intestinal obstruction from the vaccine, because the vaccine's in your gut.
Right.
It replicates, it irritates, and your gut freaks out, and your gut twists and gets blocked off, and it turns into a life-threatening emergency. It's called intussusception, and it's right there on the CDC vaccine information statement. Intussusception can happen after this vaccine. 1 in 20,000 will get that, whereas about 1 in a million will die of the actual disease. So again, you have to understand the risk versus benefits. Finally, the flu. Flu vaccine is 6 months. Again, I think we'll just wrap it up real quick. We've already done some flu episodes, and you can go back and listen to those if you want. But essentially, we're just talking babies now, you guys. The life of maybe a baby in the first year or two of life. What diseases might they catch in that first year? Flu, about 20 babies die each year of the flu. And the flu vaccine, it might reduce the risk of catching of dying from the flu by a little bit, but the data are not very good on that. It's the least effective vaccine we have.
Right.
All these other vaccines give you a pretty high level of immunity in some cases, but the flu vaccine doesn't. It's a very low level of effective immunity.
It says here, 2017, the national vital statistics.
Yes.
18 babies under 1 year died of actual influenza. Right. Yeah, which is like you said, it's always sad. It's always sad that anybody's dying of anything, but that's a really, really low number.
Right.
When you think of some of the other things that babies are dying of, people don't realize that are dying of much more frequently than that. And
I think to wrap it up here. On a later podcast, we're basically going to go through what are the disease risks for older kids. Today's podcast is really you have a new baby, you're thinking about vaccinating, you want to know what are the dangerous diseases for your little baby. We will then talk about the childhood diseases that can go on throughout the rest of childhood.
We get to do
another
this again?
Episode. Well, not this time. We'll do it another time. We'll give you a break. We'll file this for later. But I think so. It's basically, why do some parents make the choice not to do some of these vaccines? Like, why would someone even choose to opt out of a vaccine instead of choosing to opt in? And I think it really kind of comes down to some parents look at the risks of the vaccines, like encephalitis, seizures, multiple chemicals in the vaccines like aluminum and formaldehyde. How vaccines have been linked to raising your risk of allergic problems like eczema and asthma.
Autoimmune disorders. Yeah.
Autoimmune disorders. I mean, a lot of parents look at the disease risk and say that disease risk is comfortably low to me, that I almost feel more comfortable living with those disease risks versus taking the vaccine risk. And that's what patients will describe to me. Mm-hmm. And I'm not saying that's the better choice.
Well, it's whatever choice works for your family with your health practitioner. And again, it's just important to know both sides of it.
Right.
So that you see this other part of it. Because I was definitely told in the hospital, like, if you don't get, I chose to get the Tdap vaccine after I gave birth because I was uncomfortable with getting it during pregnancy. Mm-hmm. And the only reason I got it after I gave birth was they basically told me your child is going to be dying of pertussis if you don't get this. Right. I mean, that's really the language that it was painted at. So I felt very pressured and I felt very fearful of that, to the point where obviously I gave my oldest 2 months, 4 months, and 6 months that vaccine as well. And then I got it myself. And it was just the way that it was presented. And like you've said, pertussis is serious and it is very frequent. But there are also some things you can do to kind of make sure that you are not a statistic as much as possible. Right. And you're not, if I would have known how little protection I would have been given with that vaccine for myself anyway, I mean, that vaccine just isn't 100%. It's never foolproof. And I think it's important to understand that part too.
Yeah. And I guess I want to close with, there's that common misconception that vaccines don't have any risk. There are no serious side effects.
I was
right.
Told,
so like, why wouldn't you do that?
Right. It's so simple.
It's so simple. Why wouldn't a parent do them if vaccines create no risk? that misconception is really not supported by research. If you look at the research and the warnings that come with the vaccines, there clearly is vaccine risk. Mm-hmm. And there's also very clearly disease risk.
Right.
And you as a parent get to make that decision.
Yeah.
So, all right. Again, a new parent episode there. And, put your comments on our Facebook page, our Immunity Education Group Facebook page. If you want, ask us some questions, comments. We look at all those. We've been looking at those comments, questions, and if you have a specific question about what you heard today, post it there, and be sure to rate our podcast.
And we've just only put sneak peeks up so far, so it's been nice to get all of the feedback, and hundreds of people have been checking it out and responding and commenting, and gotten a lot of great feedback. Just happy that we're having this conversation. So we're happy you guys are joining us for it.
All right. Yeah, we'll see you guys next time on the Vaccine Conversation.
We're gonna be the peace we wanna see in the world. Yeah, the peace we wanna see in the world. Be the love we wanna see in the world. Be the joy we wanna see in the world. Be the change we wanna see in the world.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.